My name is Sarah Griffin. I'm a two-time CNSC, a master's educated dietitian. I currently work in an ICU in Denver, Colorado, and I'm the owner and founder of Edge Clinical Nutrition. Today, we're going to talk about CNSC exam study hacks. So I've taken this exam twice. I took it for the first time in 2019, passed on my first try, took it again in September 2024 for my 5-year recert and passed on my first try as well. This exam has gotten much, much harder in the past few years. And so I'm going to go over today some specific study hacks tailored to this exam, which will help you succeed. So first off, a lot of students ask me what type of calculations will be on the exam. Do I really have to know these calculations and do I have to commit them to memory? So the answer is yes. There are several calculations that you'll have to have memorized, but I'll tell you exactly which ones in my study guide. You will have access to a digital calculator on the exam, so you can do the calculations with the calculator. It's similar to the calculator that you have on your computer. If you press the calculator icon and a calculator pops up, just a very standard digital calculator, and you'll have that on the exam. So my study guide will show you exactly which calculations you need to memorize and perhaps more importantly, which ones you do not have to commit to memory for this exam. But briefly, you need to be very familiar with BMI, including converting from pounds to kilos to do that in your head or with the calculator. Ideal body weight, you should be able to calculate that on your own without help. Energy and protein needs for most disease states, and this is where my study guide really comes in. If you don't want to page through the entire 847-page Aspen Adult Nutrition Support Core Curriculum, who has time to do that? My study guide has pulled out all of the energy and protein needs for the disease states that you will see on the CNSC exam and has organized those in a very specific way. But you do need to be familiar with all of those, like short bowel, liver, oncology, pediatrics, how much calorie and protein do these folks need? You should be familiar with basic nutrition support calculations, including percentages. So what percentage of a tube feeding formula is protein, or if a certain tube feeding formula has 20% protein, be able to calculate how many calories that contains. Also percentages for TPN and PPN. So for example, this parenteral nutrition formulation has 30% dextrose or 10% lipid or whatever. And then be pretty familiar with the holiday cigar method for fluid. That's a weight-based fluid calculation that we use sometimes with kids. So a couple study tips, solo versus group. A lot of people ask me if it's better to study by yourself or in a group, what I recommend for this particular exam. I would say similar to whatever you did for your RD exam. I know that's probably a long time in the past for many of us, but you should know at this point, maybe you haven't taken a big exam in the last 5 or 10 years, but based on your knowledge of the RD exam, did you do best studying by yourself or as a group or maybe a mix of both? I think most people do well with a mix of both. So for example, group studying can be very distracting, but it can be super, super helpful to help you understand, do I know enough? Sometimes your friends know things that you don't and vice versa. And it's also really helpful as a group to be able to quiz each other. So I strongly recommend a variety of or a combination of solo and group studying. So for example, by yourself, you can go through the study guide once or twice, take a lot of notes, drill in some specific topics that perhaps are not in your niche or you don't remember. And then as a group, you can do flashcards, practice exams, teach back method, things like that. Speaking out loud to retain information can be really helpful. So I know this sounds a little dorky, but if you just walk around your apartment or your house, you're taking a walk, you can say key concepts and terms out loud to help improve memory retention. So another tip would be if you find it helpful, if you're a podcast listener, you really like to listen to that audio version, or if you did Gene Inman like I did to study for my RD exam, I found that audio version to be very, very helpful. Now, I can't only learn that way. I actually am much more visual than audio in terms of my learning style, but a lot of people are a mix. And so it's helpful to have visual learning, auditory learning, and tactile learning, right? So the auditory piece can come in and you can do this on your own. Just open a voice note app on your phone. And especially if there's some information on the study guide or in your study materials that is confusing or hard for you that you're not going to remember very easily, you can just read it out to yourself on the voice note app and then play it back when you're on a walk. That can really, really help. Sometimes it's also helpful just to give the eyes a break and switch and go outside, take the dog on a walk, go on a walk yourself for mental health, get some sunshine, and just listen to the information too. The teach back method can be really helpful as well. And this is why it's helpful to have a group. So you can use the teach back method. If there's a really complicated concept that you're struggling with, like acid-base balance, teach it back to a friend and vice versa. I also do recommend a little bit of studying right before bed, but not too much. So hear me out. A little bit of studying right before bed can significantly improve your retention you have to be very careful not to overdo it. So I generally don't recommend studying right before bed because that's when we're often tired. Excessive studying, of course, can interfere with your sleep, and sleep is super important. But right before bed, what I would always do is do 5 or 10 flashcards, maybe 5 minutes of reading, just a little bit, review a table, review a graph right before bed. And then as you sleep, you'll be surprised how much of that information you retain if you look at it right before bed. But the key here is you have to do it immediately before bed. So don't read a book after, don't look at your phone after, don't listen to a podcast after, watch TV after. You have to go straight to bed so that information deposits in your brain as you sleep. Some test tips specifically for this exam. So keep in mind, not all answers will be present. So this is a place that trips up a lot of first-time test takers, is where they read all 4 answers and they think, well, there's other options. That's not really the best option. There's another option. Be aware that not all answers are going to be present. So often they're asking for the best answer. So be sure to read the answer a couple times to see exactly what they're asking for, and be aware that they're intentionally not going to have all answers present. Don't be distracted by an answer that's factually accurate but doesn't answer the question. This is a big place where a lot of people get questions wrong. They read the question briefly, they read all 4 answers, and they say, oh, answer A is correct. That might be factually accurate, but maybe it doesn't answer their question. So be sure to read and read over again. Every question you should read at least 2 or 3 times so that you understand what they're trying to ask. And don't be hasty and just select the first answer that sounds right. Ultimately, on this exam, you will have to guess. So have a strategy for guessing going in. Don't plan on being like, well, I'm going to just get every answer right, or I'm not going to strategically guess, or I'm just going to leave guessing to the end. Actually go into this exam with the plan for guessing. So there will be questions that you don't know. You can go through part 1 and flag questions. You have 2 hours to do part 1, so you can flag questions you don't know, then go back and try them again. If you still don't know them after you flag them and gone back and tried them again, then you need to have a strategy for guessing. So typically the best strategy is to eliminate 1 or 2 answers that you know are wrong, and then take a guess, just a random guess. And then you have a 30 to 50% chance of getting it correct. You can go back within the same section. So part 1 and part 2 with a break in between. And part 1 and part 2 are both 2 hours. So when you do part 1, you can flag questions throughout, go back to the beginning of part 1 and kind of take another pass at those questions. Sometimes what happens is there might be a question about copper and zinc at the very, very beginning. You flag that, I don't know the answer. Question 36 is another question about copper and zinc, and that kind of jogs your memory. Oh, that's what they're talking about. So then you go back to question 2 and you're able to better answer that. So I do recommend going through, flagging questions that you don't know the answer to. If you're not sure, if you're not 80% sure, don't even answer it right away. Go ahead and flag it, because sometimes what happens is if we make we just randomly pick an answer, or we guess right off the bat without taking a second pass, then we might be prone to change our answer, or vice versa. We might go back and see, like, I think my answer was correct. Whereas if you actually don't know the answer, don't even click an answer. Just flag it, go back, take another pass, and then on your second pass through the part 1 or part 2, on your second pass, you can take another try, and either maybe your memory has been jogged and you think you know the answer now, and you can choose what you think is the right answer, or go ahead and guess strategically. So also we want to make sure that we're not changing our initial answer. So sometimes our initial answer is the best one, and we can overthink it and change it to the wrong answer. So this is why I recommend only selecting answers for the questions that you're pretty certain on, leaving the rest blank, and going back and taking a second pass. I also want to talk about another concept called strategic failure, which it can be very, very powerful for this exam. So strategic failure involves finding a concept, and I only want to let you pick 1 or maybe 2 concepts that you know are going to be on this exam, and you know that you're just not going to be able to remember it. So maybe this is acid-base balance, maybe this is hypohypernatremia, maybe this is dosing guidelines for micronutrients, or something like that. I mean, you can't choose all pediatric content, but choose 1 specific content area that you know is going to be on the exam. There's probably going to be between 2 and 5 questions about it. And instead of wasting your time, especially as you get close to taking your test, you could spend the next 2 to 3 weeks really drilling down that particular area, and you may or may not actually feel confident on that area going into the exam, versus just saying, I'm not going to know this, and moving on and working on the rest. This exam is designed that you can get questions wrong and still pass. You can actually get quite a few questions wrong and still pass. So strategic failure is actually really helpful. You need to be very intentional about choosing a specific area. Only one or two areas are allowed. And I don't mean like a whole section of the exam. I just mean like one specific kind of niche area. You're like, this is just really hard for me. I'm not going to be able to figure this out. And instead of wasting time trying to drill and drill and drill, just make sure that you're very well prepared for the other areas of the exam.